My name is Katie Mae Robinette. I have worked at UAMS for 9 years in the neonatal intensive care unit. The last year, I've had lots of anxieties and fears due to COVID. I was actually pregnant last year, and with COVID, while you're pregnant, you are considered high risk. So being high risk and pregnant, I was always stressed for myself and my baby while I was working in the hospital. But since then, we have found the answer that we've been looking for, and that's been the vaccine.
My name is Colin Montgomery. I'm the adult sickle cell nurse practitioner here at UAMS. I've been at UAMS for 13 years. I started my career here as a nursing student, and I've progressed in my nursing career. So in April of last year, I was experiencing some fatigue. One of the wise physicians here recommended that I was COVID tested. We really didn't think it was COVID, but I've been working in an area that I had potential for high exposure, so we just went ahead and I was tested, and I tested positive for COVID. So when I talk to friends or associates, they often say their chief concern with getting the vaccination is we just don't have long-term data on what could happen in the future after I get the vaccine. And I think for me, having coronavirus and then seeing patients that have had it, the short-term effects of having the disease are definitely worse, in my opinion, than worrying about the long-term effects of the vaccination. My determining factor for getting the vaccine was I take care of sickle cell patients, and we are recommending that they get the vaccine just because of the devastating effects that COVID can have on them. And as a provider, I feel like I cannot ask a patient to do something that I am not willing to do as well. So I was vaccinated, and I've had both vaccines, no side effects, no issues, little soreness in my arm, but other than that, I had none of the side effects from it. And I think it was a great choice to be vaccinated.
My name is Henry Campbell Gomez, and I'm a respiratory therapist at University of Arkansas Medical Sciences, and I've been here about 6 years now. I do work with COVID patients. I do work in the ICU with COVID patients. I've treated some that recover fairly quickly. I've recovered of others that are pretty sick, pretty critical. Some on ventilators. Unfortunately, once you get to the ventilator stage, it's not very likely that you'll survive. It's affected my family closely. My mother-in-law died from COVID the Friday before Christmas. My mom, in a nursing home in San Antonio, was affected by COVID. She was infected, and she recovered, thankfully. My 17-year-old daughter, who's a senior student at Central High, also had COVID over the summer, and she recovered. It can be scary. It can be stressful, but with vaccinations, I think we can beat this. We can beat COVID. We'll be stronger than COVID.
Right now, it's kind of uncertain on how long your immunity is after you have coronavirus. So I struggled, honestly, to get the vaccine because the fatigue from having the virus was so bad and it was so debilitating. I didn't think that I could do that again after getting the vaccine.
The emotional side effects that I had were relief, hope, and gratitude. Relief that I have the vaccine, I can go to work and feel safe and keep my family safe. Hope that our normal will be soon in the future, and gratitude for everyone that has worked so hard to get us here.